In today's video, I will be explaining the earliest time you can do a pregnancy test and symptoms of early pregnancy. I'll be using this whiteboard here to give a simple illustration on the earliest time you can do a pregnancy test and why. If you're new to my channel, I am Dr. Amarachi Ijeoma. I am a fertility physician, and my channel focuses on everything women's health and fertility. So if this is the kind of content you're interested in, keep watching. So the only time a pregnancy test can be positive is after implantation has occurred. So what is implantation? Okay, so this is a rough sketch of how your uterus looks. This is your cervix. This is where the period blood comes out from. This is also where the baby comes out from, okay? This is your vagina. These are your ovaries. This and these are your ovaries. You have two ovaries in your body. This and this are your fallopian tubes. This is usually where your baby will lie, and these are the muscles because your womb, your uterus is made up of muscles. So let's go to the beginning of implantation and how it occurs. So for you to have a baby, for you to be pregnant, you have to ovulate. And ovulation is release of egg from the ovaries into the fallopian tube. Now, these two are your ovaries. These circular things you're seeing here are called follicles. They contain water with the egg suspended inside it. If you can see, the egg is in the middle because it's suspended in water. So these are the eggs. So for your ovary to actually release an egg, one of these follicles has to rupture, has to burst, so that the egg can come out of it. And then this finger-like projection on the fallopian tube will now pick it up and then put it into the tube. So during ovulation, it is the biggest follicle that is closest to the hand, the finger-like projection of the fallopian tube that actually ruptures and releases the egg. So what happens is this one now will come here, release the egg, okay? Then the finger-like projection of the fallopian tube will pick up the egg and then push it into the fallopian tube. So if you notice the drawing of the fallopian tube is not straight, that's because the fallopian tube is moving like this in the body. It's moving. Why is it doing this? So that it can propel, so that it can keep pushing the egg forward so that it can enter the uterus. So what it does is it pushes it and pushes it while it's doing like this, and then it gets here. So what happens here?
So after ejaculation, the sperm swims really fast all the way to the fallopian tube and waits for about 3 to 5 days for the egg to be released from the ovary during ovulation.
So these are the sperm cells. So remember that it is only one sperm that can fertilize the egg. So it's the fastest one, the one that gets there the fastest. It now penetrates the egg, it pierces the egg, and fertilization occurs. Fertilization usually occurs in the fallopian tube. So this usually occurs day 1 after ovulation. So we write day 1. On day 1, a zygote is formed. What is a zygote? It's a combination of the male and the female genetic material because the sperm has penetrated the egg, so it has put its own genetic material inside. And then this is the female genetic material. So this is a zygote. Then the fallopian tube keeps moving, moving because it's trying to push it all the way into the uterus so that it can implant. So on day 2, the genetic material is dividing more. This is day 3, day 4, day 5. Then on day 6, something happens. Usually, this is when the blastocyst penetrates the wall of the uterus and pregnancy occurs. So, for this blastocyst, on the 6th day after ovulation to implant, it will now grow finger like extensions because it has to grow something that can pierce, that can penetrate the wall of the uterus. These are the finger like projections. So now it has attached itself to the wall of the uterus. And once this happens, the pregnancy hormone is produced and then it rises in your blood. And this is when and only when you can do a pregnancy test. This is called implantation. Immediately, this blastocyst penetrates the wall of the uterus. It is called implantation. So now, from the explanation, you understand that implantation occurs day 6 after ovulation. However, it's not the same in every woman. So it can actually occur between day 6 and day 10 after ovulation. In some women, the implantation occurs day 7, day 8, day 9, day 10. What happens is on day 5, it still gets into the uterus, like it still gets here into the uterus, except in rare cases. So it will now linger somewhere around in the uterus till day 7 or day 8 or day 9 till it's ready to implant. But it usually does not exceed day 12. Rarely it can even implant on day 5. If you're actively trying to get pregnant and you have an understanding of on how to calculate your ovulation and you have sexual intercourse around the time of your ovulation, the best time, the earliest time you can actually do a pregnancy test is between day 6 to day 10 after ovulation. In rare cases, you can see it on day 5 after ovulation. So the best time to do a pregnancy test is anytime from 6 days after ovulation to 14 days after ovulation. This is because if you fall under the category of women that implantation occurs on day 6, then if you do your pregnancy test the very next day, it will be positive because once implantation occurs, it produces the pregnancy hormone and it increases in your bloodstream. Then pregnancy test will be positive. So for some women, they start to do their pregnancy test day 6 after ovulation. They do it day 6. They will do it on day 7, day 8, day 9, all the way through till they find a positive pregnancy test. Well, this is not really advisable in my opinion. I would not advise this. I would advise that you wait till day 14 to do a pregnancy test. That is the best time to do a pregnancy test because you don't want to risk doing the pregnancy test too early and then having anxiety and then getting worried and then losing hope. Meanwhile, it just takes a few more days before your own implant because it's different from the next woman. So what are the early pregnancy symptoms to look out for and why? Now let's go back to implantation. Pregnancy symptoms, implantation symptoms can only occur after implantation has occurred. Once implantation occurs and produces the pregnancy hormone, it is that pregnancy hormone that starts to cause all of the pregnancy symptoms. So you see how implantation has to occur for pregnancy symptoms to occur. So what happens? What's the first symptom to look out for? So the first symptom you can look out for is implantation bleeding. What is implantation bleeding? Usually, when the blastocyst uses its finger-like projection to penetrate the wall of the vessel, sometimes there are blood vessels hanging around here. Okay? That's blood vessels are vessels that contain blood. And when this blastocyst penetrates the wall, sometimes a blood vessel can be very close to the part where it is penetrating. And then it will now pierce the blood vessel. Blood will now escape from that vessel into the uterus. And then it will come out of your vagina as little tricks of blood. So this can be a little confusing for women because they might think that it's their period blood. Meanwhile, it's implantation bleeding. So how do you differentiate implantation bleeding from period blood? So the first way to differentiate implantation bleeding from period bleeding is the implantation bleeding is usually a lot smaller than the period blood. Sometimes it's just your vaginal discharge with tinge of blood. Sometimes it's just blood, but if you compare it to your regular period blood, it's a little bit smaller than your regular period blood. Then you have to notice at what point in your cycle is this bleeding occurring. Remember I said that implantation occurs 6 to 10 days after ovulation. So you will now calculate when did you ovulate, and then you calculate the day you are seeing the blood. If it is anytime from 6 to 10 days after ovulation, then it is most likely implantation bleeding. But when you now start seeing blood 13 to 14 days after ovulation, then it's most likely your period blood. Also, look out for the color. It's usually brownish or pinkish. Brownish because most times the quantity of blood you're seeing is very small, so it might take longer to leave the uterus and get to your panties. So before it actually gets to your undies, it has mixed with oxygen, it has oxidized, and it has changed the color to brown. Implantation bleeding usually lasts only for a few hours to about 2 days. For women with short cycle length, this can be a little confusing. That is, cycle length less than 21 days, it can be a little confusing. So for them, the way to differentiate implantation bleeding from period bleeding is to compare the differences with the blood you're seeing and their regular period blood. Well, you can do this with checking the color of the blood and how much blood you're seeing. Is it like a usual regular amount of blood? Also, implantation bleeding doesn't occur in every woman. It occurs in 1 in 3 women. 1 in every 3 women experience implantation bleeding. This simply means that if you do not experience implantation bleeding, it does not mean that implantation did not occur. What you need to do is look out for other symptoms. So the next symptom I'll be talking about is cramps, implantation cramps. So this is another confusing one. Like imagine implantation has occurred for you and then you experience implantation bleeding and then you now experience implantation cramps. You will now be wondering, is this my period? Because for some women, their normal period experience is bleeding and cramps. So how do you differentiate implantation cramps from your period cramps? Okay, firstly, how does implantation cramps even occur in the first place? So when this blastocyst penetrates the wall of the uterus and pierces a blood vessel, the blood that escapes into the uterine cavity can irritate the lining of the uterus. And when this happens, it can cause the uterus to contract a little bit. So you now feel it as cramps. So to differentiate implantation cramps from period cramps is that implantation cramps is usually milder than your period cramps, and it usually doesn't last as long as your period cramps. So the third implantation symptom to look out for is pregnancy symptoms. Again, pregnancy symptoms can only occur after implantation has occurred, because it is when implantation occurs that the pregnancy hormone is produced and released into the bloodstream, and it's this hormone that causes all of the pregnancy symptoms. So what are these symptoms we are looking out for? Heavy breast, tender breast, that is your breast is a little bit painful, the feeling that you want to vomit, headache, weakness. Again, this can be a little confusing for some women that experience all of these symptoms after ovulation. So where this stems from is the fact that during ovulation, that is when the ovary releases an egg, and you know that for the ovary to release an egg, this follicle that contains the egg has to burst, has to rupture for the egg to be released. So that remaining material that has collapsed, the remaining follicle that has collapsed, will now produce high amounts of another hormone called progesterone. Now, this progesterone is what causes these symptoms in some women of heavy breast, tender breast, headaches, weakness, feeling of bloatedness, and sometimes feeling like they want to throw up. So for women that usually have these symptoms after ovulation, how to differentiate the pregnancy symptoms from the ovulation symptoms is to compare the differences. Okay, am I having these same symptoms I have during ovulation plus implantation bleeding? Am I having the same symptoms plus implantation cramps? So these are the little ways you can differentiate the pregnancy symptoms from the ovulation symptoms if you're someone that has these symptoms after ovulation as well. So when you have the pregnancy symptoms, that's the headache, fatigue, nausea, heavy breasts, tender breasts, earlier than 6 days after ovulation, then it is most likely ovulation symptoms. But if you're having all these pregnancy symptoms anytime after 6 days of ovulation, after 6 days, 7 days, 8 days, 9 days after ovulation, then it is most likely implantation symptoms. However, there are some cases where women have reported that they felt these symptoms earlier than 6 days post ovulation till 2 weeks after ovulation. And when they did their pregnancy test, it was positive. And then there are women that even after 6 days post ovulation to the 14th day post ovulation, they did not feel, they did not experience any pregnancy symptoms. And when they did the pregnancy test, it was positive. So these symptoms vary in intensity from woman to woman to woman. So for some women, they might experience it more than other women. For some other women, they might not even experience it at all. So after 2 weeks post-ovulation, when pregnancy is confirmed, some women have reported that the pregnancy symptoms became heightened. In fact, the feeling of vomiting became vomiting. Every other symptom became heightened. So this brings me to the end of today's video. If you found it informative and you want more educative videos like this, click the subscribe button below, share with your friends, and see you in my next video.